Hi everybody, in this video we're talking about degenerative disc disease and what we can do to make this back pain go away. Welcome to the Health How-To channel where we talk about some great life hacks and easy tips to achieve better health. Please subscribe and share your best tips that you have found to be helpful for relieving pain from degenerative disc disease so that we can all benefit in our own personal journey to better health. Anytime you get a diagnosis with the word disease at the end, it makes you feel scared, right? And so when the doctor pronounces your excruciating back pain as the result of degenerative disc disease, does it make it seem like all hope is lost and you're doomed to have pain for the rest of your life? The thing about the term degenerative disc disease is that it's misleading. Would you call gray hair or wrinkles a disease? Probably not. The loss of pigment in our hair and the amount of elasticity and plumpness in our skin happens to everybody with time. It's a natural process of aging. Now you might be thinking, but gray hair and wrinkles aren't painful. They don't make me hobble around in the morning or stop me from mowing the lawn. True. The disc degenerative process starts to show on x-rays by the time you reach your 40s. Extensive research shows that about 30% of people in their 30s have degenerative discs, and 90% of x-rays and MRIs show degeneration in people in their 60s. So what that means is that x-ray or MRI findings of degenerative discs do not correlate with back pain. However, what can make spinal discs painful are nerve growth into the disc and tearing of the outer rim of the disc. Our discs lose water with age and become thinner and more compact. Their shape can change depending on your activities of daily living. Somebody who has had a sitting job like an office worker or a truck driver has more pressure on their discs than someone who moves around more, like a teacher, for example. How do you manage your disc-related back pain? Now, you may be wondering if you can reverse degenerative disc disease. The short answer is no. Because there is very little blood supply in discs, the healing potential is poor. The better question to ask is, can you get rid of disc-related pain? And the short answer is yes. Will it go away 100%? That depends on how long you've had pain for and the extent of the damage to your spine. Things like herniated, bulged, or slipped discs are typically pain-free in a matter of 1 to 6 weeks. But 20 years of back pain from a work injury or car accident usually requires a shift in your lifestyle. What kind of shift? These are lifelong habits that improve your body's and mind's resiliency to pain and ultimately help give you a better quality of life. And let's face it, just like a car, the older our body gets, the more time, care, and maintenance it needs. Here are 8 lifestyle habits to manage degenerative disc-related back pain. Number 1, stay flexible. Ask anybody who is older and they can give you a laundry list of all the joints that are stiff, achy, and snap, crackle, and pop. If you want to have well-lubricated joints, you need to stretch gently and regularly. Stretching in the morning after a hot shower can help you get moving, and stretching at night after an Epsom salt bath can help de-stress your muscles and joints, give you a better night's sleep, and potentially an easier morning. Number 2, keep building muscle to protect and stabilize your spine and joints. The discs help keep your vertebrae well spaced and cushioned, like having water pillows between your vertebrae. Now, if we start to lose water and these pillows are thinner, what else can you do? Think of strengthening like wrapping wide rubber bands around your spine. Rubber bands, like muscle, can tighten and stretch, and the thicker the rubber band, the more pressure and friction is offloaded from the bony elements of your spine. We start losing 3 to 8% of our muscle mass after the age of 30, and that number really starts to increase after the age of 60. Now, nobody is telling you to go to the gym to become a muscle-bound giant. There are safe and simple ways of strengthening. It's really important to be aware of your form so that you don't injure your back more. One more thing to remember, it becomes harder and harder to build and repair muscle as you age. So you need to be patient and kind to yourself. Depending on your age, the goal of just maintaining your muscle may be more realistic. Check out our video on safe back exercises that don't involve bending. Number 3, know which exercises to avoid. A physiotherapist can provide you with a truly customized plan to suit your body and lifestyle. Some potentially aggravating exercises are high impact jumping and cardio, trampoline, running, certain weightlifting moves like deadlifts and crunches, advanced yoga and Pilates positions that involve extreme twisting and bending combinations. Number 4, maintain a healthy body mass. Your body mass index is a number that relates your weight to your height. Other health weight considerations are your ethnic background, which relates to your body frame, composition, and fat distribution. Research has shown that a high body mass index is strongly related to low back pain. 47% of people who had a low or average body mass index complained of back pain, whereas 73% of people with a high body mass index suffered from back pain. Number 5, our bodies adapt to our daily activities and positions, meaning that if we frequently sit slouched over, then our spines stiffen up in a forward curve, and our muscles, like our hip flexors, can get short and tight. Our core stabilizing muscles in our abdomen and back become weak. It's the same adaptation that occurs if we avoid vigorous activity that elevates our heart rate. Then our heart muscles also become weaker and we get out of breath more easily. Number 6, since thinning discs may move and distribute forces differently, we may also have to avoid positions that maximize the pressure through our discs. For example, standing straight puts 100% pressure through the discs in your low back, but sitting in a forward slouched position can increase the pressure through your discs by 180%. Sitting straight reduces the pressure to 140%, and reclining backwards lessens the pressure to 105%. Retrain the way you do some of your daily activities, such as the simple act of loading the dishwasher or even changing how you get up from a chair or the bed. The safest spine-sparing ways involve keeping your spine fairly straight and using the largest muscles like your glutes, quads, and hamstrings to do the work. Check out our video on ways that you may be unknowingly making your sciatica worse. Number 7, explore and practice coping skills for stress. Stress and pain are intertwined and can create a terrible cycle of more pain leading to more stress, which leads to more pain. Your muscles, particularly in the neck, back, and stomach, can unconsciously tighten and stay tight even after your perceived stress has gone away. Watch some of our videos on stress relief and chronic pain for some additional tips. And finally, number 8, consider changing your diet to reduce inflammatory foods. Loading up on leafy greens, fatty fish, nuts, fermented foods, and turmeric can help. Check out our anti-inflammatory diet video for more information. Please subscribe and turn on notifications so you don't miss any health how-to videos where we talk about easy ways to improve your health. Thanks for watching, and I'll see you in the next video.